Welcome everyone to the Woodbridge Pavilion. This is a outpatient facility that is part of Meridian Health Raritan Bay Medical Center. It's a pleasure to be able to host you this afternoon. As I was coming, I was thinking, when organizations come together and try to do something, it generally takes months and months. But when you want to do the right thing for the right purpose and the right people, things can move fast. And it was 40 days ago that a number of us met in Senator Vitale's office and began talking about this program. Monday of this week, the first replacement kits were already given out. 40 days. In my career of almost 40 years, I've never seen anything move so fast. It shows you when you're doing the right thing, how people and organizations can work together. And it really has been a pleasure working with the prosecutor's office and Senator Vitale's office and Woodbridge and the mayor to make this happen. The other thing I want to comment on is it also shows how important it has been for us to become part of the Meridian Health system. We have in the audience today Russ Malloy, who's the Senior Vice President of Government Relations, and Carl Maslak, who's the Pharmacy Director from Southern Ocean County Hospital. The program was already in place in Monmouth and Ocean County, put together through Meridian Health System. Were it not for Meridian, we never would have been able to move so fast. So it is absolutely a pleasure to be part of such an outstanding effort to really help people in this addiction and to have this antidote available. So it's my pleasure now to introduce the man who actually started this whole thing in the Senate, Senator Vitale, Joe Vitale. Joe?
Thank you, Mike. I just want to thank Mike and Raritan Bay and Meridian now, who is just a great partner for that system and for this community, and Mayor McCormick, of course, and Prosecutor Carey and his team, and Mac and your team. There's tremendous work pulling this together. I want to thank my staff and your staff for all their great work. This past fall, as Mike said, Director Hubner met with the mayor and myself and our staff, discussed the issues relating to the naloxone program, and they had used their one-time funding source to initially train and equip their officers with naloxone, but have no source of really recurring funding to make it sustainable and keep the program going. I researched the issue and learned that the Monmouth and Ocean County folks had developed a replenishment program with their hospitals. Meridian Health Systems hospitals participating in the program in Monmouth and Ocean. Knowing that Meridian and Raritan Bay were merging and actively looking at the time, I certainly reached out to the medical center and Mike at his initial hospital system to work with here in Middlesex County. Soon after the hospitals merged, we convened that group with the prosecutor, with Mike Dagnes, Russ Malloy, Woodbridge Police Director Hubner, Mayor McCormick, and his leadership team, Bob Landolfi and Carolyn Ehrlich. We learned about the program that Meridian participated in Monmouth and Ocean, and they agreed to bring that program here to Middlesex. And the prosecutor agreed to work with them to develop the necessary materials for the implementation. Meridian then went to work with leadership at Raritan Bay, in Perth Amboy and in Old Bridge, purchased the materials needed, stockpiled the supplies of naloxone in the ER pharmacy, and trained their staff how to exchange the used naloxone kit for a new one. To Raritan Bay and Meridian deserved a ton of credit for stepping up to the plate to fully fund the program, not just in Woodbridge Township for our officers, but for police officers throughout Middlesex County. Just as an aside, I really want to work with the insurance companies to see if we can find a real pathway to having this covered on a sustainable basis. When I authored the Overdose Prevention Act, we knew that was going to do great things and save lives. The 911 phone calls that would go unpunished by those who were with the person who overdosed would be a great thing. But the next question was always, what's next? What happens when we save someone? So we're going to get to that, and that's going to be an important part of this process. Going forward is to connect people to treatment, a pathway to get them into care if they're ready for that care. We know there's a chronic disease and faces so many people in this state, but the naloxone program, what our officers and what this team is doing, is going to save lives and put people, hopefully, God willing, on the right path to healing and to treatment for their lives. So thank you again for your work, Freeholder Director, and all the others who participated in this. Looking forward to a great success here in our state, also particularly here in Middlesex County now as we move this forward as one of the models for our communities. So thanks so much. Want me to introduce I want to introduce the prosecutor, Andrew Carey, who's done great work in Middlesex County on a number of things. Last year or two, we did a little ride along about midnight in New Brunswick to just observe some of the activity in the community and those who were on the street selling drugs late at night. But many of them, those low-level dealers, are victims themselves. They're in many ways also have a substance abuse disorder, and that's the way they're used by those big dealers to get that work done. So I want to thank him for the work he's done on that, on this. He's been a great partner in law enforcement. Thank you.
Good afternoon. It's no secret that law enforcement officers are asked to do more and more every day. Their burdens become more, nothing gets taken off of their plate. But law enforcement in Middlesex County, I must say, continues to step up to the plate and get the job done. Every police department in every town in Middlesex County has the naloxone available. Last year, there were 171 NARCAN deployments, and I believe it's about an 85% revival rate on those. There's been 47 naloxone deployments in the county this year, so clearly the numbers are on the rise. And in law enforcement, we know that we cannot do our job alone. It requires partnerships, cooperation, and coordination. We all have to work together to combat heroin and opiate addiction, and that's exactly what's happened here. Through the use of one simple form, the cops can deploy the naloxone, go into the hospital, get their replacement, and be back on the street. And for that, I'm incredibly thankful. I would like to thank Michael Dagnes, Raritan Bay Medical Center, for what he's put together, the folks at Meridian Health, Carl and Russ, Senator Joe Vitale, very notably Freeholder Rios and Freeholder Polos, who consistently support the law enforcement efforts here in Middlesex County. They do a lot of things behind the scenes. The county is able to sponsor things that get pushed down to the towns. And Ron, I appreciate everything you do for us here. Woodbridge Police Director Robert Hubner and Association of the Chiefs of Police that also worked on this. And I'd like to especially thank Woodbridge Mayor John McCormick. John does a lot of things behind the scenes as well. He supports the Narcotics Enforcement Association. I've been at places where he's spoken. He supports law enforcement and to get addicts the help that they need. And of course, I thank the police departments and the police officers that are on the street every day saving lives. Thank you, sir. As we move forward, I look forward to working with these people because we have a few things that we must do. And as a chief law enforcement officer, I must tell you that we absolutely cannot stop our efforts to target those that are responsible for the illegal drug trade, those who are responsible for the violence, those who are making the profits. The big drug dealers do not care that addicts are dying every day on the streets. We must combat that as well. And at the same time, we will work together to get real help for the addicts. And we'll continue to cooperate together to make that happen. And thirdly, to educate everybody to keep them off drugs in the first place. Those are our goals, and together we stand. Thank you very much. It's a great day.
Thank you very much. I wish I didn't have to be here, but I have to as Mayor of Woodbridge because we have a problem like everybody else. In the last 12 months, we've had 65 NARCAN deployments. That's staggering. It's not as much as many other towns and other counties, but it's 65 too many. One is too many. Last year, we had a NARCAN deployment at a house for a kid in his 20s, a young man in his 20s. That night, we went back to the same house. NARCAN deployed his father. The next day, we went back to the same house and used NARCAN again on the young man. 2 weeks ago, we had a call to a house where it was a fatality, attempted NARCAN deployment, but the person passed away. 2 days later, same house, call again, person passed away. Both times, unrelated people, both times from heroin overdoses. So we have an issue here in Woodbridge Township, and we have to deal with it. Everybody talked about the team here. This is an all-star team. This is just a group of people. This is not Meridian, not Raritan Bay. This is Mike Diagnos. This is the president. This is not somebody from the county prosecutor's office. This is the county prosecutor, Andrew Carey. This is not a Woodbridge police officer. This is our police director, Bob Hubner. This is not some state legislator. This is Joe Vitale, chairman of the Senate Health Committee. This is the all-star team in this area, Middlesex County, and everybody here is dedicated to fighting this problem, and we stand committed as a town. We, in fact, want to go further, and we're putting together some plans now. There are 5 target counties, pilot counties in the state that are dealing with the peer recovery program, peer recovery coach program. Middlesex is not one of them, which is good because we're not one of the 5 worst counties. That's the good news. But the bad news is that I don't know when the state's going to get around to having enough money for the next group, the next 5. They're short on the first 5. Everybody we've talked to said the money they provided isn't even enough yet. So we're looking at ways to work with everybody up here to have Woodbridge get started. We were one of the first towns in the state to use NARCAN. We want to be one of the first towns in the state to get out and do our own recovery coach program. I'm challenging Mr. Diagnos here right now to work with us. You need the hospitals. You need them to agree to let the peer coaches in to see the patients before they get released. They're often belligerent. They often don't want to, but the doctors in the emergency rooms have to be able to work with and call up the recovery coaches to come in. And most of the times, the recovery coaches, if not all the times, they're Narcan survivors themselves. They're heroin users themselves. And part of their therapy, actually, is to work as a peer recovery coach with people that they stood in their shoes. They walked the walk. They were there exactly where these people are. So that's why it's so important that we put this program in Woodbridge. And we can't wait for the state. We just can't wait for funding. We don't mind putting the money toward it. We've worked with several professionals. We've had meeting with so many other people who've experienced this, from Barnabas to Avis Helper and Passaic, and we have more meetings scheduled. We don't want to just do Narcan. We want to do more and more, and we're still working out the details. We have cooperation of Mr. Carey in the prosecutor's office. As I said, when you have Joe Vitale on your side and anything related to health in the state, you're doing really, really well. There's nobody better. Our police department stands by. But anyway, today I just want to thank Mike and thank Raritan Bay for stepping up. Thank everybody else up here for this program. It's hard to admit we have a problem, but we do. But we have to take all the steps we can to continue to fight the problem. And I want to count on everybody up here to go past just the Narcan kits. And let's really work on getting people the counseling they need and go further, maybe the medication they need. We're learning more and more every day about this issue. It's a problem. We have to deal with it. Thank you all up here for everything you've done. Forgot to say Ronnie Rios. We don't have the freeholders. We have the freeholder director. So this is an all-star team up here. We're through the first inning, but it's a long, long game, and we have to keep working and stay at the plate and keep. We hit a couple singles here and there. We have to start hitting doubles and home runs and really, tackle this problem and make sure we beat it. Thanks very much.
Mayor, we accept your challenge and we're in.
All right. All right.
It is an all-star team, as the mayor stated, and I can't thank all the players on this team that cooperated and addressed this problem. It is a problem. It's nationwide. It's worldwide. And right here in Middlesex County, everybody's stepping up to the plate. I can't thank enough Senator Vitale, Mayor McCormick, our prosecutor, Andrew Carey, and everybody that's involved, the police department. It's teamwork, and that's what gets the job done. And hopefully we'll eradicate this problem sooner than later. Thank you.
Any questions for anybody up here? Hearing none, thank you all for being here. We are completed. Thank you.